for health science education. And we're just pleased to have such a large crowd here today to hear these wonderful presenters. Just a little bit about the consortium and what our approach is to be helpful to teachers throughout the nation. One of our strategic priorities is really professional development, and we want to do what we can to enhance and grow and really make your health science education programs what you want them to be. So we started doing webinars on a fairly regular basis back in January. We've seen the popularity go up tremendously, and we think that has a lot to do with we have a captive audience now for sure. But we'd also like to think that we have some topics that are of extreme interest to you and hopefully to your students as well. All the webinars are recorded, as you see here on Phyllis's slide. I appreciate Phyllis Johnson. She's our past chair for the consortium and the work that she does to help us set up the webinar. So these are all recorded, and the speakers today will be sharing their PowerPoint, and so that will be posted on our website. And you see the website there in the top corner of this slide at healthscienceconsortium.org/webinars. So within the next few days, the recording will be there, something that you could share with your students, as well as their PowerPoint that you would be able to use with your students too. We have a couple of webinars planned. There's one on Saturday. Hopefully you got information about that today. And that is a camp that you can come in and out of with lots of resources for teaching online. And then there's one on April the 8th, another Wednesday webinar about assessments. And then one on April 22nd, which is another Wednesday. And that is will be about assessments. I'm sorry, that one's about QR codes and how you can use those in your classroom. So Phyllis, are you changing to their, is that what you're doing now? Changing to their screen? Phyllis?
I got knocked off, so
Okay.
I'm back on now. Yeah, that's what happens. They're going to share their slides. So.
Okay. All right. Well, it's our pleasure today. We actually met these two nice ladies in St. Louis last year at the 2019 National Health Science Conference, and they had a booth there in our expo area. And so I began the conversation with them then about what the work that they do at Mid-Atlantic Transplant, and how I thought that that would be a topic of interest to our teachers and our students. And so we started talking, and then we selected the month of April, and they'll tell you why shortly. And so it's with great pleasure that I introduce these two ladies, and they'll tell you a little bit about the work that they do, and you're in for a real treat. Thank you, Sarah Dana, and also Tara Skaggs for being with us today.
All right, can everyone hear me now? Tara, can you hear me?
Yes.
Okay, awesome. Well, welcome everybody. Thanks so much for joining us today. I know Tara and I are extremely excited to have the opportunity to share this information with all of you. I'll just start by introducing myself. My name is Sarah Danner. I live in St. Louis, Missouri, and with Mid-America Transplant for 3 years now in the role of education for organ and tissue donation. So it's really an honor to be here and share this information with all of you, as you are mostly educators in this audience. A lot of that with students in our area. So it's really great to be reaching educators all over the country. You want to say a few things about yourself?
Sure, I'm Tara Skaggs. I live in Springfield, Missouri, but I am a regional employee for Mid-America Transplant based out of St. Louis. And so I've been with Mid-America Transplant for almost 6 years now. I started as a donor family who was just willing to tell my story. And it opened up into all of this passion that I'm going to tell you about today.
Thanks, Tara. I too am a donor family, and so and also a recipient family. So this really hits us personally, both of us, and I think you'll kind of see that in the way that we present, and then we are very passionate about this and feel it is very important not to educate those in the community, but educating our students. And I know that in the description of this webinar, we talked about why it's important for the students, because they're right at that age for those high school teachers where they're going to the DMV to get their driver's license, and they're being asked that question, do you want to be an organ and tissue donor? Really understand what that means, and are they giving the answer that's going to be best for them and their families? So we hope that today we not only inspire all of you to not only understand the content, but then hopefully to register as an organ and tissue donor, but then hopefully to pass this information along to friends and family, but even more importantly, your students in your classroom. Especially given everything that's going on right now with COVID-19, and we know that kids aren't physically in the schools. This is a great opportunity to take this education online. So again, these slides will be available to you via the link that I shared with you earlier. I think you would have also gotten an email with that link, but you are more than welcome to also reach out to Tara or myself for any additional information that you might need. So with that, let's go ahead and get started. Sorry guys, let me get my slides going. Alrighty, so as mentioned before, we chose to have this webinar in April on purpose, because today being April 1st marks the first day of National Donate Life Month. This is an exciting time for us at Mid-America Transplant and in the donation community all over the country, because this is a month that we truly focus on our mission even harder. This is a time that we can celebrate life, but it's also a time that we are remembering and honoring those donors who were heroes in giving the gift of life to so many others who needed it. So we're very excited to share this information during such a special time our year. All right, and I'm going to start a video. I don't know if a lot of webinars you've been on have included videos, but we have 3 of them that we felt were kind of special. This one is just going to give you all a high-level overview of the donation process, and then we can kind of dig a little deeper and answer any questions at the end.
Every year, many thousands of people receive the gift of life, a life-saving transplant of a heart, kidney, liver, lungs, pancreas, or intestines. And thousands more people receive corneas and other tissues that restore sight and health. Transplantation is one of the great medical advances of our time. How does it work? It all starts when someone's organ begins to fail, and that person will need a transplant to survive. A thorough evaluation is conducted at a transplant center, and if the person's a good candidate for a transplant, he or she will be put on the National Transplant Waiting List. Once a person is on the list, the wait for an organ begins. A national system matches people on the waiting list with donors. The factors considered in matching donors and recipients include blood type and body size, how sick the patient is, distance from the donor, tissue type, and length of time on the waiting list. What doesn't get taken into account? Organs are never matched based on race or gender. Income, celebrity, and social status are also never considered in matching donor organs to waiting patients. There's no telling how long the wait will take. In fact, some people don't receive an organ in time because the waiting list is very long and there aren't enough donors available. That's why an average of 18 people on the waiting list die each day. In Imagine how many we could save if we all were donors. Most organs for transplants come from deceased donors. Here's how that happens. A person comes to the hospital with a life-threatening brain injury, such as from an accident, a stroke, or lack of oxygen. The doctors work hard to save the patient's life, but sometimes nothing can be done. There's a complete, irreversible loss of brain function. The patient is clinically and legally dead. That's when being a donor can turn a time of loss into a time of hope. Because machines have kept blood containing oxygen flowing to the organs, they can be passed along. One person can give life to as many as 8 people through organ donation and enhance the lives of 50 people or more through eye and tissue donation. But now, minutes matter. Matches must be found, and transplants must happen quickly. The hospital contacts an organ procurement organization, an OPO. OPOs manage the organ recovery process. The OPO checks the state organ donor registry. If the person is already registered as a donor, they'll inform the family. If not, they'll ask the family to authorize donation. A medical examination takes place. They check the medical and social history, and if the person is eligible to be an organ donor, the computer begins the search on the national waiting list for well-matched patients. The best matched patients for each organ are contacted by their transplant teams. This is the call that every single person on the waiting list has been hoping for. The call that could mean a second chance at life. Now the transplant happens. A surgical team recovers the organs, then corneas and other tissues. The organs are sent to the transplant hospitals where the patients and transplant teams are waiting, and the life-saving transplants take place. It will take healthy living and medications to keep the organ working well in its new home. But some wonderful person has given the most precious gift of all, the gift of life. You too can make the decision today to sign up on your state registry as an organ, eye, and tissue donor. Any age is the right age, young or old. And any day is the right day to sign up as a donor. You can register through your driver's license office, or you can sign up right now, online. Remember to tell your family so they can support your wishes. More than 100 million people have already signed up, but we're all needed to save more lives. Go to organdonor.gov and sign up in your state donor registry as an organ, eye, and tissue donor. Go to organdonor.gov and share the gift of life.
All right. Tara, can you give me a thumbs up if you can hear me? Okay, great. I hope everybody could hear that video. We did a test run and it seemed to be working okay. If anybody could not, I do believe there's a link in the slides, in the notes of the slides. So if you get those later, you can check that out at a later time. Alrighty, so just to give you a little bit of background of Mid-America Transplant, I always like to clarify that we are not a hospital. We do partner with all of our area hospitals, but we are what they call an organ and tissue procurement organization, which is a lot of words to say. So that's why in the video you heard them reference an OPO. And we are actually one of 58 OPOs in the country. And in just a second, I'm going to show you what that means as far as geography goes. But just to kind of give you an overview of what our responsibilities look like at an OPO, you can see the 3 big ones here. So we evaluate potential donors. We get phone calls from our hospitals, from our medical examiners, letting us know that there has been a death to be reported. And that is what allows us to start the process looking into donation. So it's always just nice to clarify that we are not part of that patient's care while they are still alive. We want to keep that completely separate. And then once we get that notification of a patient's death, that's when Mid-America Transplant becomes involved, and we look into their medical record to determine if donation is a possibility. Once we have that step done, then we also will have that conversation with the family. So whether that means over the phone or in person on site, we have teams that specialize in doing just that so that we can have those conversations with the family to help them through this process. And then finally, what makes us unique at Mid-America Transplant is that we were actually the first in the world as the OPO to build an on-site recovery unit. So what that means is that most other OPOs, when donation is taking place, it all has to be coordinated within the hospital. So we're using the hospital's resources, the hospital's testing departments, the hospital's operating rooms, which is fine. Obviously that works. That's how many others do it. But again, you're looking at doing that in a very busy hospital with a lot of other people who are depending on services. And so we built an on-site recovery unit back in 2008 that allows for the donor to be transported from the hospital to our facility in St. Louis, which happens about 95% of the time, to allow for the donation process, that's the actual surgery in the operating room, to occur in our facility. And that way, the staff that are taking care of those donors, that is their only job. They're taking care of those donors, and everything within the donation process is our focus. So it really allows for us to just give the family a better experience once they've consented to donation, and maximize donation to save more lives. I mentioned we are one of 58 OPOs in the country. So every OPO has their own geographic territory, or what we call a designated service area, or a DSA. So our DSA, as you can see on the map here, covers 3 different states, part of 3 different states. So we serve Southern Illinois, Eastern Missouri, over into Springfield, where Tara is from, and then down into the northeast part of Arkansas near Jonesboro. So we have a pretty large geographic territory, 4.7 million people over those 84 counties. So we're serving a lot of families, and we're doing a lot of education. So it's just really amazing that we're even able to spread further today with this webinar. I mentioned we are not a hospital, but you can see there's a lot of hospital partners that we work with, because again, that's how we're getting those referrals and getting that donation process to start. We're very fortunate, especially right here in St. Louis, where I'm from, that of those 122 hospital partners, 4 of those hospitals also serve as transplant centers, which means that people who need those life-saving gifts can come here, and we have 2 adult centers and 2 children's centers that allow for those life-saving gifts to occur. So those 2 adult centers include Barnes Jewish Hospital and St. Louis University Hospital. And then our kiddos have the opportunity to go to St. Louis Children's Hospital, along with Cardinal Glennon Hospital as well. So I'm very fortunate to have that, because a lot of times when those organs are able to stay in our area, our building is literally 5 to 10 minutes from all 4 of those hospitals. So that transport isn't taking very long, and we can quickly get those surgeries going for those life-saving gifts. I'm sure if any of you are like me and watch Grey's Anatomy or any of those medical shows, you've probably heard of the waiting list, or you may have just heard of it, you know, in the news, in the newspaper, things like that. But the waiting list is definitely a real thing, and unfortunately, it's a very large thing. In our country right now, there's about 112,000 people waiting on that list for that life-saving gift, and this is just specifically talking about organ. So that's a lot of people. Here in St. Louis, I know I'm a big Cardinals fan. Unfortunately, we're not going to be at Busch Stadium tomorrow, but I use Busch Stadium as kind of our visual aid to kind of say we could fill it up about 2.5 times. And that's how many people need a life-saving gift. So if that gives you kind of that visual to help you understand that there is a great need for people to sign up to be donors. Locally, just in our area, within those 4 transplant centers I mentioned, there's about 1,200 people. Of course, that number is going to vary depending on where you are in the country, but it's still too big, right? There's still people waiting. We're trying to get rid of that waiting list, but unfortunately right now, that's how it is. And so we're trying to encourage as many people as we can to sign up to be donors. And to give you just a little bit of extra perspective, I know this always helped me when I first saw this slide, but to kind of just let you know how very important every single person's yes on the donor registry actually is. We can look at this example. So in our service area, so in that map that I showed you just a little bit ago, within about a year's time, we had about 30,000 deaths reported to us. So you might look at that number and think, wow, that's a lot of deaths. That's a lot of potential for organs and tissues to be donated to other people. So if you're one of those people who maybe hasn't signed up on the donor registry and you're kind of on the fence about it, I want you to think about this. Of those 30,000 people who you think may be a very large potential, the reality of it is after we've looked through all the criteria and determined full eligibility, it's really only going to be about, I think, what we say, Tara, about 450, a little under 500 at this point. So about 1% of those people. So see how quickly that number drops. You know, that's just pretty incredible that there are 1,200 people just in our area in the Midwest, in St. Louis, but yet only about 450 people able to donate. So you can already see that discrepancy and see how there's going to be people on that waiting list who don't make it because they're not going to get that life-saving gift simply because there aren't enough donors. So this is one visual I like to show to kind of help people understand that even as cheesy as it can sound, every single person's yes matters. And then before I hand this over to Tara, I just want to also kind of give this visual. This is what we call our funnel. This was updated just recently to show last year's numbers for Mid-America Transplant. But in that, again, that service area I showed you in about 1 year's time, we had those 30,000 deaths that I just mentioned. And so again, I mentioned, oh, there it is. I'm sorry. 475 was the number, that approximately 1% are going to be those donors who are actually eligible. So again, a huge drop right off the bat. And then of those 475, 351 of them said yes. But medically and looking through all the criteria at the end of 2019, we were able to successfully have 271 donors. So even though that's wonderful because we know that this is life-saving, 271 people, that's it, to help try to save all the people who are on the waiting list. So even though we're going to try to, you know, keep doing what we're doing, we're going to get that education out there, we really got to keep doing this because there just aren't enough donors. All right, I'm going to hand this slide over to Tara. I'm not sure. Phyllis, are you able to unmute Tara?
Thank you. I think she just did it.
There you go.
So as you can see on this slide, these are the organs that can be donated. This is how one person can help up to 8 people. So the heart, kidneys, liver, lungs, pancreas, and small intestine. The kidneys could go to 2 different people. The lungs could also go to 2. Sometimes you might have a kidney-pancreas combination even. And the liver is incredible. So I've served donor families that have had a laceration in their liver. Maybe they were a car accident, had sutures in place. You can still gift a lacerated liver to someone because the liver will regenerate itself. It's incredible. We do not work in the living side of living donation. It's not what an OPO does. But there are 3 different organs that can be donated as a living donor. And I find it to be fascinating, which is the kidneys, the lungs even, which, because we have 5 lobes, you can donate 1, and then of course the liver. I just find that to be fascinating. Again, it is not the realm that the OPO works in. Something else to know about the organs is that they need a ventilator in place. You have to have a ventilator, which is also known as life support, or a brain death declaration. Brain death is not the only way, but it is the most general, most frequent way that these vital organs are being donated. So when we talk about allocation, we are saying how we find a recipient, how the life-saving organ is gifted to another person that's waiting on the list. And this, what you see here, is just the bare minimum basic things that have to begin the process of finding someone, and blood type is always going to be first. Sometimes your medical urgency, I mean, it always goes to the sickest person first as well. Sometimes your wait time has been so long, now your medical urgency has increased, or your medical urgency is that dire that the wait time is now, needs to be now. Size compatibility and age will go hand in hand because a 5-year-old can't gift to a 50-year-old man and vice versa. The chest cavities have to match. Size matters for that reason. I like the geographic location because each organ will dictate how far it can stay outside of a body. Meaning the heart has 4 to 6 hours. It needs to stay somewhere close. The lungs are also that way. The liver can go 12 hours. The kidney we're going to show you a picture later, they go on a kidney pump, which means these kidneys can go from Missouri to California or New York to help somebody far away, because they can go on a pump. So that pump lasts 24 to 36 hours. The geographic location is changing as medicine advances. They're trying to go as far as they possibly can now with these organs to save as many people as they possibly can. And of course, we're going to get you the organ that is needed whenever you need it. So but these are the very basic ways. Whenever we have a family that said yes to organ donation and we're trying to find that recipient to match this, these are the ways that starts. Oh, so the tissue. For me, it's the unsung hero. It's the one that doesn't need the ventilator in place. So this doesn't have to have the brain death declaration. And one person can help up to approximately 75 people from their gift. So this one yes can change the lives of and enhance the lives of up to 75 people. So what you see in the skin, you can think of it as like a sunburn in the summertime. That top layers is most generally gifted for burn victims, breast cancer survivors who've had mastectomies. Bone cancer used to be the only answer for people that had bone cancer was amputation. Now, when you're gifted a tissue from a human person, your body knows what to do with it. So it's able to grow, it maintains temperature, it promotes healing. Heart valves are almost always being gifted to a child, a baby, or a mother of childbearing age. Tendons and ligaments are a lot more frequent, probably, that you'll hear more if you know an athlete that had an ACL recovery and they had a cadaver gift. I kind of hate the word cadaver, although I understand fully what it is. But for me, it's a gift from someone that said yes. So to just narrow that down to a cadaver, for me, it's a donor. It is a donor family. It's a family that on their darkest day said yes to donation, gifting these gifts to enhance the lives of people. Tissue does not take, it's not as time sensitive. So this can sit and wait for just the right person. The cornea, we're going to show you some pictures in a little bit, but the cornea and sclera are fascinating. The cornea is the contact lens part of your eye, and it's giving sight to people who are losing their sight and can't see. And the sclera is even being used, which is the white part of your eye, is being used to heal eardrums that have been ruptured. It's fascinating, and people are getting a phone call in the middle of the night sometimes to ask the question of tissue. So what you're going to hear throughout this entire presentation is, and the reason that we want to talk to you as teachers and the reason that we want to talk to students is to say, they're being asked the question in the DMV at the age of 15. We want to tell you what you're saying yes to or what you're saying no to. And we want to show you that these are the questions that are being asked of people. And when you know the answer, you know how to say, yes, I will answer that question at 2 a.m. for my loved one because I know that's what they wanted. And tissue is part of that. These are people who have passed away in a hospital emergency room, maybe didn't get to the ICU and connected to a ventilator, and unfortunately they passed right there. That family has now left the hospital and they're getting a phone call. And so can you imagine if you don't know the answer to the question, you call and we're calling to say, would you give this gift? And they say, you want what? My loved one just passed away and you're asking me to do what? If they know the answer to the question and they have the education that you guys are getting now, you're leaving an answer, you're not leaving a question. And I think you'll see the importance of that as we continue talking. So one of the things that we've said multiple times, and we're kind of, I don't know, any of us that work for Mid-America Transplant, we're kind of over the top with our pride. But what the next slide I want to show you is a behind the scenes video of our facility, how we do things. We were the first in the world to have it. There are 11 OPOs now that are following our structure of how we do things. You'll see how we do it here in this video.
There's 58 OPOs, organ procurement organizations, in the United States. Only 405 have their own freestanding facility with a surgical center.
It's very unique that we have this. Most people have to stay in the hospital to take care of their donors. We can get results fast and we can treat things quicker. We transfer well over 95% of the patients and manage them here versus managing them at the hospital that they were pronounced dead in. Being here and having control over the patient, we can manage them a lot
better and improve our outcomes.
When we get back to MTS, we have a lot of things to do. Transport the donor to CT, get a CT, move them into the ICU, draw all sorts of labs, draw serologies, do a bronchoscopy.
We're the only OPO that has a CAT scanner on site. Pancreas looks normal here. Heart looks okay here.
We have our serology testing just down the hallway, and our HLA testing is all run here.
When we see something, we can act on it. And all of that turns around into better care. We see the results in getting more organs per donor, and lives are saved because of it. Years ago, the people that were managing the donors were basically the transplant surgeons. At this facility in 2008, we took a different direction, and we had critical care physicians managing them. And the nurses are incredibly well trained and very proficient in doing it. And our numbers here for sure have increased more than 100 organs per year in that period of time.
There is no way that one single coordinator could do this job by themselves. It does take a team. It does take a very healthy working team to get this job done.
And they have to make quick decisions to stabilize patients, and they do an incredible job, and they're very well trained, they're very bright, and they have a deep passion for taking care of these patients.
I came from an ICU where patients passed away and the story ended there, and I always wanted to be involved in something that could bring a brighter light to death, and I ended up at MidAmerica.
I'm very fortunate to work with a great team. We enjoy working together. We're all very passionate about the cause. Our mission is to save lives. It's simple. I mean, that's it.
One donor can potentially affect 8 different people. That's exciting.
I feel very strongly that it gives the donor families something to hang on to in the worst moment of their life. And I just thought that it was an amazing process that I really wanted to be a part of.
Why I keep doing this job. It's just really great to be able to make a difference in people's lives.
So that video that you saw is fairly old now compared to what you're seeing here. This is our new 6-bed ICU. And as Sarah was talking about, we move these patients out of the hospital service to bring them here. And it's better care for the donors. It's better care for the donor families. This allows the families to leave the hospital service, get a shower, a hot meal, start planning a funeral they weren't prepared to do. It allows them to come into this service. Say if we needed a chest x-ray, or we need a bronchoscopy, or we need blood work drawn, we need anything done with that donor, it can be done in our facility here and quickly. Say we needed to wait for a chest x-ray in the hospital. We have to wait for a doctor to put it in the computer to order it. We have to wait for the tech to come down and get them, take them to where they need to go for that test, bring them back, wait for a radiologist to read it. All of that takes time. That is not necessary, and it's not that way here in our facility at all. And so this takes care of the donor. They're MVP in this building. They're the whole reason that this building stands. A lot of the things that we do, I mean, it's a hurdle to ask the question of, okay, first organ and tissue donation. They say yes to that so graciously. By the way, we're moving your patient and your loved one, and you just have to say goodbye to them connected to the ventilator and everything's still in place. I mean, it's a big ask. But if they can understand where they're going and why they're going there, and the reason that it's okay for them to go there, they usually understand it. I have served multiple families in my position as a family support specialist of young people, and I never took that for granted, the question that I was asking them to move their child to this facility. But I've walked by the ICU and I've seen hands being patted, hair being brushed back. Our nurses are top notch, and they know that this person's loved by people, and they're very well taken care of here. Some of the things that we do for these donors and their families is to put a fleece blanket on them that are made by our volunteers. That stays with them for the duration of their flight, the duration of the time that they're there, kicking death square in the mouth. That blanket stays on them the whole time, and then the family gets that blanket back at the end of everything. Something else you'll see in this next picture here is the family support specialists are asking families to fill out that white card that you see there. It's called a moment of silence card. This, as a family support specialist, I did that for 5 years. This was tough. This was hard to ask them to do, because you're asking them to write something about their loved one. Maybe it's their favorite song. But what this does is it stops the trauma surgeons, it stops every nurse, it stops everybody, and it takes it from, you don't ever want it to be, ever want it to be just an organ or a pair of kidneys. You want this to always be a gift being gifted by this loved one. And we honor that person that way. And so this right here, this picture that you're seeing is the whole room has stopped and they're reading what the family once read about that card. And it moves our nurses to tears every time. And I think most of them would say when it stops doing that, they should probably go find something else to do. But I love that we do that for our donor families and our donors, and it stops everybody and says, this person matters to all of us in this room, and we want to say that one more time.
Yeah, that's a pretty special moment. So we're just going to quickly go through a few more pictures just to give you an idea of kind of what it looks like in our recovery unit, in our operating room. You can see here there are multiple surgeons once it starts, a lot of hands on deck that, you know, make this happen. It's pretty remarkable what we can actually do with donation given all the people involved. Here you can see the sterile ice being prepared because each organ, of course, once that blood supply is cut off, we want to minimize any, you know, death of cells in the organ. So they're going to be put on sterile ice to help preserve them. Here's a picture of a kidney. You can see there's a little bit of that yellow part is some fat, which will be trimmed off. That'll be cleaned up before it's transplanted, but just to give you an idea of what that looks like. Here's the pump, the kidney pump that Tara referenced earlier, or a couple of them actually. So you can see on the left, there's actually a kidney in there that's hooked up using different preservation fluid that continues to go through it, basically making the kidney think that it's still, you know, in the body working so that the cold time is minimized. This is a picture of a liver. Again, you'll see a little bit of fat on it that'll be cleaned up, but you can see what's being put into that sterile ice into the bag. And then everything is actually triple bagged once it's in that sterile ice. We want to make sure everything is sanitary and making sure nothing goes wrong between the time it's coming out of the donor and going into the recipient. Just a quick show of the labeling. This is actually an older picture. Everything now has gone to barcodes and electronic scanning to make sure we know where that is at all times. But the point to take away from this picture and then this one here is that there is just extensive labeling. We always want to make sure that everything is labeled appropriately, so you're not hearing any of those crazy stories you might have heard in the past of getting the wrong organ or getting an organ to the wrong person. So this is our way of just kind of double, triple checking that process.
I always have the kids in the classroom reference this picture as something they've seen on Grey's Anatomy, and they always question the cooler, and this is something that is actually pretty accurate. Not pretty accurate, it is that way, but it always causes a little giggle. And the UNOS number that you would have seen in the 2 slides before that is something that's familiar from Grey's Anatomy as well. There is a UNOS number, it's an identifier. Instead of saying Tara Skaggs is gifting her right kidney, it says AZL346 or something like that. It's 3 letters, 3 numbers, something like that. So it de-identifies the person and tells it how it's going. That's something that's right about Grey's Anatomy, but we spend a lot of time in the classroom dispelling the myths of what Grey's Anatomy does for us. So the next picture I always get on a little bit of a soapbox about, and I guess when I have to travel to St. Louis for meetings, I almost always look for this, and it is more that is a surgeon getting on an ambulance, taking that life-saving organ to someone to save their life. That's something that you'll see on TV too, but when I see that ambulance parked outside the building when I go, it stops me dead in my tracks every time, and I feel like the minute it stops doing that, I should probably go find something else to do. But that truck right there means somebody died. And when they died, their family said yes to donation. And there was a family support specialist there that day who gave their guts to serve that family. And the family has thought of someone else on their darkest day. There was an organ procurement coordinator or 3 who gave their guts to making sure that all of this came together on one day and one time, everybody. So if there was a heart surgeon coming from Tennessee and kidneys coming from New Mexico, needing to go to New Mexico, whatever it is, that ambulance sitting there says that that's working. That ambulance sitting there says that there are surgeons inside that building that are getting ready to leave, and it also means that there is a recipient who has gotten a call of a lifetime to say that somebody you don't know wants to gift you an organ, and it's working. And they're all in the building right now, and they're getting ready to do that. So I feel like whenever I see that truck, and it's just a truck, I should probably go find something else to do, but that truck's getting ready to go, red lights and siren, either to the transplant surgeon centers up the road, or they're going to go to that airport and get that organ to where it needs to go. And it's fascinating work, and I'll never touch the level of what it is ever in my life.
All right, so to transition to just a few more pictures on the tissue side, we just wanted to kind of give you an idea of what that looks like. So you'll see here a picture of a skin graft that we used on a burn victim. Again, we mentioned these tissues earlier. Long bone, these are going to be either from the arms or legs, but like I had mentioned before, this could be a potential life-saving gift for somebody who might have bone cancer. They're able to remove the bone and with the donated bone, and not only help save their life due to the cancer, but then also eliminate the need for any kind of amputation. Bone is it's pretty neat though, because it's not only the long bone that could be transplanted, it might be cut in different sizes or different shapes depending on what the recipient needs. So, if let's say, if you can look at this picture here, somebody needs a cervical piece for a spinal surgery, that physician can let us know the exact measurements needed for that specific patient, and that bone can then be cut to that exact specification for that person. I'm going to show you the before picture here. It's pretty graphic, but this is a 13-year-old patient who has severe scoliosis. As you can see, her spine looks nothing like any of ours, I'm sure. And I always like to remind people that when we talk about tissue, we generally say that it's life-enhancing instead of life-saving like organ can be, that we're more familiar with. But I can almost guarantee you that if you talk to this young lady after everything she's gone through, she's probably leaning a little more toward the life-saving option of this tissue donation, because the way she was prior to her surgeries, I mean, look, just sitting in a chair or standing up, even just breathing. Can you imagine how painful that must have been for her, how uncomfortable that must have been? Her quality of life just, I'm sure, wasn't all that high. After multiple surgeries, and because, again, somebody said yes to donation, she was able to get that straightened out. And I mean, look at that. That looks pretty darn normal to me. And so again, that's going to be, life-changing for her, because now I'm sure she's able to do so much more in her life than she would have been able to prior to that.
Maybe should have given you a heads up. That picture was.
Sorry about that.
I could have done it too. So this is a picture of the cornea, which is the contact lens part of your eye, and it just is restoring vision to people who do not have it. So one person could potentially help give sight to two people. And the picture of our eye bank here is something that we also have on site at our facility. So the donor never leaves the building to have anything done. They go straight from our facility back to the funeral home where the family has chosen. But all of this is done in our facility.
All right, so as Tara's mentioned, when we talk to students, we're battling TV shows and movies and things in the news, even just misinformation that's out there from maybe generation to generation, just out in the community. So donation concerns are definitely things that we hear about and we want to educate on. So a few that we run into, the first one being that the doctors will not try as hard to save me if they know I'm a donor. This is a pretty consistent concern that I hear in St. Louis where I'm at. I'm sure it's probably all over the country. But we just want you to understand that this is not the case. So the fact of the matter is that your commitment to donation is not going to interfere with your medical care. So if you're in an accident or something happens and you go to the emergency room or you're admitted to the hospital, that medical team that is taking care of you, you are their number one priority. You are everything that they're doing. They are going to use every resource possible to save your life. And honestly, most of the time, they don't know what your donor status even is at that point. So they are trying to do everything they can to save you. And then not until a death declaration has even been made does Mid-America Transplant or any other OPO get involved. I'd like to clarify that. All right, let's see, this is still me. Okay, so you can sell your organs. We weren't gonna put this one in here just because it's not our favorite one, but given that we talk to students, and I know a lot of people on here are educators who will also be talking to students, can say with like 100% certainty, and I'm sure Tara will agree with me, that every single high school group of students I talk to, somebody always mentions the black market. Kind of have to chuckle at them and say, you know what, you're right. It's out there, like people talk about it. Things are done that aren't very good. And so that goes into our fact is that it's completely illegal, just like the black market. You know, there are probably things done in other countries very similarly to that. And I just always tell them, for one, you know, it's illegal. You can't do that in the United States. That's why we have the rules and regulations that we do. But I also want you to think about those outcomes because they're probably not going to be very good. So that's why anytime we're talking about donation and transplant, it's not anything happening in a back alley or cash under the table. It is strictly happening in our hospitals and in our OPOs.
This one is a one that we get often. I can't have an open casket funeral is a concern. Everything is replaced with a prosthetic. It does not change the viewing of a person that has made the choice to be a donor at all. This is also one that I have been known to say that this is another reason why knowing the answer to the question is so big. Because if you can imagine the family being asked in the hospitals the question of donation, answering that question, and then also being asked this question in order to make the best choice for what they need to do for their family members, this is another thing that's big too. So having an open casket funeral is a question they're also being asked. It does not change the viewing of that at all. Another concern that we have is, will the families be charged for donation? Do they pay for any of that? And the answer is no. It's our expense. Anything having to do with organ donation from the time of death to the time that the body is returned to the funeral home, it's at our expense. So everything is taken care of. The family will never see anything having to do with organ donation.
All right, and then a couple more we hear, my religion does not support donation. And so, you know, we always want to make sure we're addressing that, as we know that there are many religions in our country. But please understand that most all major religions do support organ, eye, and tissue donation. They see that as the final act of love and generosity toward others. So that is something that we are able to talk to families about and give them that education as well. And finally, this is one I know personally, I hear this one a lot out in the community. I'll be talking to someone who may be in their 60s or 70s and just say, I'm too old. Nobody's going to want my organs or tissues. I'm not going to sign up. And I just always like to come back with is nobody's ever too old to say yes. And that goes into our fact as well, where it's really regardless of your age, but also your race or your medical history. So somebody might even say, oh, well, I've had cancer or I've had this disease in the past. You know, you're not the doctor. That's what I kind of joke with them about. When that time comes, let the medical staff at the OPO and hospitals determine whether or not you're a candidate. You have the power to say yes and give them the opportunity to do that evaluation. Because if you say no and just assume that you can't for whatever reason, you're taking away that opportunity and potentially wasting gifts that could have saved some lives.
I think we'll quickly go through here how we can support donation, and that is to just obviously sign up on your registry and the national registry. Since most of you aren't even from where we're from, there is a national registry. We'll show you a couple examples here of what it looks like in the state of Missouri there, that little red heart there at the bottom. Illinois will have just the donor symbol on the right side there. Arkansas literally just says organ donor under that picture. The Organ Procurement Organization is the only people in the world that have access to this registry, so there are no doctors who could stop what they're doing and go, what you're doing here, to see if they need to, they don't even have access to it. We are the only ones that have access to that. So signing up on your registry is the biggest thing, but we'll show you, I hope that you've learned today that having the conversation with your family too just really drives that home so your family knows how to answer the question. I guess I'll just let Sarah take over that one.
Okay, so yeah, so to wrap up, we're just going to show one more quick video. It's just a quick minute, but really this is one of my favorite parts of the whole presentation, because we just sat here for, you know, what, 45 minutes or so, kind of telling you how everything works with a few, you know, stories, but this is really, to me, important to understand why it makes such a difference. So I'm going to go ahead and show you that video.
My name is Darren Gill, and I'm a heart transplant recipient.
She is the recipient of a cornea transplant.
I am a heart transplant recipient.
Chase is a heart transplant recipient.
I'm a double cornea recipient.
I am a kidney recipient.
I was going blind.
I had liver cancer.
Waiting for a heart was really, really hard.
The day I received a call, I ran and told all my family. I said, I gotta go. I got my heart.
I could just have a normal life, whatever that meant for me, normal.
I play with my grandkids. They're always chasing me around the house. So
she has vision in her eye and she can see.
I never got to meet my donor because she had to die for me to get her liver. They're a great family, and I'm really glad I got to have met them.
I was able to see my daughter graduate from high school.
Thank you. You made a difference in my life.
Thank you. You don't know how much this feels to me. This is the ultimate blessing, the ultimate blessing.
All right, well, I hope you, again, were able to hear that. That always touches my heart because it really it makes it real. It helps you to understand how important all that truly can be. So to finalize here, I just wanted to share, Tara and I both wanted to share with you some online resources. Again, these will be in the slides that you can access, but a few websites with some great information, including our website. Along with our website, I also wanted to share specifically Mid-America Transplant's social media handles. I'd encourage you all, whether it's our OPO or your local OPO, to follow them on your social media, just to keep up with what's happening, hear stories, see pictures, be a part of events and different things that are happening. Just really quickly before we end today, I wanted to also share with you some really important information, given our audience is nationwide. Tara and I take a lot of pride in doing local education, but this is for you teachers. This is a 30-minute online lesson plan through what we call Learn Lifesavers. This was formed through a few different organizations that came together, all with the mission of educating on organ and tissue donation, that allows you as a teacher to take on that lesson and this in the classroom, or maybe do it virtually, given everything we're going through right now. But it's a really great way to give some general information that's not specific to a certain OPO or a certain part of the country, and that way it can be used anywhere in any state. So I'd encourage you all to check out learnlifesavers.com, and some contact information on that website as well in case you have any questions or concerns. All right, and so here's our contact information. Again, we encourage you to reach out to us if you have any questions, or if you're in Missouri or close by and would like to have us help you with any education. We would love that. But I hope that you would either reach out via phone or email. And on behalf of both of us, that we just thank you so much for giving us this opportunity and for joining in today. And we hope that we can make a difference together. So thank you.
Okay, Sarah and Tara, again, this is Nancy Allen, and I'll just encourage, if anyone has questions, you're welcome to put those in the chat box and we'll be watching. I did see a question in the chat feature that asked, could you be a donor if you're a donor recipient?
You always have an opportunity to still save someone's life, even if you have received a gift yourself. No one's ruled out for that.
Okay. Also, I thought it might be of interest. You said, I believe we heard in the video, there are 58 different centers in the United States that are similar to Mid-Atlantic Transplant. Are you all in a collaborative? Like, is that a link where you all are to in a association together that we could share with our teachers across the nation?
Yeah, I think, Tara, wouldn't you say AOPO would be the answer to that?
Mm-hmm.
Yeah, so there is an organization, AOPO. I'm not sure if it's .com or .org. That website is kind of links as the Association for All OPOs. So that would be a resource to go to learn about all the different ones in our country.
Okay. And also the organ procurement coordinators, what is their background? We were just thinking about all the different health professions that are represented in the work that you do. And I didn't know what the background, if you knew, of the organ procurement coordinators.
They are nurses, and specifically for Mid-America Transplant, they are required to have 2 years of ICU experience before they can come to work for us. I think as things transform and grow even further, we're considering doing different things as time goes on, but as of right now, the RNs are 2 years of ICU experience first, and then they're very well trained when they come to us.
Okay, here's one that says, what was your background of the both of you? What is your background?
Oh, that's a good question. I went to school to be a math teacher. Yay.
Okay.
But obviously I didn't end up going that route. So I ended up working about 10 years in a kidney transplant center. It just kind of randomly happened after I got out of college. I needed a job, and I knew someone that worked in a kidney transplant center. So I started out there and ended up working my way up within the department, but just fell in love with it and loved working with the transplant patients. And so then when it was time to move to St. Louis, this was a great opportunity to transition into.
I'm seeing so many stories of personal information here. I wish I could talk to every single one of you. I was a certified medical assistant working in orthopedics, taking out stitches and MRIs when my husband passed away at the age of 28 from brain cancer. We were still able to donate his organs, and Mid-America Transplant called and said, "We heard you have a story to tell." And I started out as a volunteer for them, and then realized I'd love to speak to families. So when the family support position came open, I went for it. And my experience trumped what in any kind of education I would have had, just because I'm comfortable running in the room when the rest of the world would probably rather run out. I'm comfortable with grief and trauma and stress, and I want to love perfect strangers with my guts when it comes to organ donation.
Oh, a great story there, Tara. There is a question here. I thought maybe we could go the whole webinar without saying the word, but there's a question about how is COVID-19 affecting transplants?
It's we're trying to be extra careful sending anyone on site to the hospitals. We're not freely doing that as we were before. Anyone that has it cannot gift anything at this time. There's just so much unknown about it that there's just no possible way that would be. We're not doing that right now, but we are taking extra caution when we have to send staff on site to work a case that has nothing to do with it. We're just being extra careful about what we're doing right now with that, and ready for it to go away.
Yes. Okay. Well, it looks like we're getting a little couple of minutes past their time, but I wanted to close with a couple of, certainly wanted to close with a thank you to you two ladies. And, we met at the 2019 National Health Science Conference. So there's an invitation for you to come to the 2020 National Health Science Conference. We'll be in Charleston, South Carolina. Everyone wants to go to Charleston, #1 tourist city. And that's going to be October the 28th through the 30th. So the consortium is choosing to think very positively that we'll be able to do that, and we would love to have you all there and doing presentation and exhibiting, and just really appreciate you being here for us today. For the teachers, if you need a certificate that documents your participation in today's webinar, you just need to email me, and you have my email in your confirmation email when you registered. So if you need, it's not a CEU, it's just 1 hour of contact for professional development. So if that's helpful to you, just reach out to me. And so Tara and Sarah, you'll see so many thank yous there for a great presentation. I joined them, and I know we had lots of states represented, but I know this information is transferable to them no matter where they are, because there's similar work that goes on in all across the United States. So thank you, everyone. And thank you so much to our two presenters for today.
Thank you, everyone.
Yes, thanks, everyone.